cardiovascular disease because of the benefits seen in the Essence trial. Dr. Mukul would take up the issue later. It has been approved even for the treatment for MASLD. Mean body weight reduction was exceeded greater than 15%, and in the semi-lean trial, it was also seen that there was some amount of muscle preservation also. So this is one thing which you should tell your patients, that patients would be losing weight. So they should have a good protein intake. They should follow regular exercise, especially resistance exercise is a must in these patients. Otherwise, they could land up in sarcopenia. That is one thing which you should be following. So step 4, again in patients who took and then stopped the drug, and one group continued the drug. So patient which continued the drug showed even benefit or greater weight loss at the end of 68 weeks, but there was some amount of weight regain in patients who stopped the drug completely. So that was seen in the step 4 trial. So 40% participants on 2.4 achieved greater than 20% reduction. There are a lot of semaglutide now going to be available in the market because of the loss of patent, but most of the trials, or rather all the trials, have been done with the originator molecule, which is injectable semaglutide, Ozempic or Wegovy, and oral semaglutide, which is Rybelsus. So step-up trial is another trial where they have gone up to 7.2 mg of semaglutide once weekly, and they have shown weight loss in terms of greater than 21%, which is a huge percentage. So probably it would be approved in the future with a higher dose for weight loss. Rybelsus has also been approved with respect to diabetes, but in the future there are trials going on with 25 and 50 mg. Probably it will also be approved for weight loss in the future. So semaglutide significant, this I have already spoken about. The sema-lean study showed preservation of muscle loss. In fact, the future is going to be a combination therapy where semaglutide is being combined with bimagrumab, which is a drug which is a actin-3 agonist, which leads to muscle preservation also along with weight loss. So probably we will have that in the future also. So 85% weight loss is fat loss with semaglutide, and it has been seen in the sema-lean study also. Significantly reduced cardiovascular risk seen in the SELECT trial in obesity, the SUSTAIN 6 trial in type 2 diabetes, the SOUL trial with oral semaglutide, and the PIONEER 6 trial with oral semaglutide. So as I have already mentioned, SELECT, SUSTAIN, SOUL, STEER and SCORE trials are important. They have real world data which have shown benefit of semaglutide, and when it compared to tirzepatide, they have shown improvement in atherosclerotic cardiovascular disease, and that is why I said that even in the SELECT trial, even before the maximal weight loss was achieved, there had been a significant separation of the curve showing benefit in terms of reduction in cardiovascular events. So there are effects beyond just weight loss because of the pleiotropic effects. One thing to be remembered, that the action on GLP-1 in semaglutide is much more than tirzepatide. So this is one difference between these two newer molecules. So head-to-head comparison, SURMOUNT-5, greater weight loss was seen with semaglutide in our population. Thank you so much for